Hello, everyone. I'm Dr. Ann Merkow, Dr. Ann for short. I'm Quad's medical director, and I have been practicing primary care internal medicine with QuadMed for nearly 25 years. I'm here today to talk to you about wearing a mask during the COVID pandemic. I'll explain why, how to put on a mask, how to store it, how to launder it, dispose of it, what to do if you sneeze with a mask on, using your cell phone, and why you should wear a mask to your doctor's office. So let's start with why you wear a mask. Well, you are wearing a mask to protect other people. And the reason is because we know a lot of people do not have symptoms when they are infected with COVID, but can be shedding virus. And people who do get sick with COVID for 48 hours prior to developing the symptoms and even realizing they're sick, they are shedding a lot of virus, so highly infectious. So the idea is it's going to prevent you from spreading COVID when you don't even know you're sick. So that's the why. Now let's talk about putting on the mask. Well, first of all, when you put the mask on, you have to have clean hands as you're going to be coming close to your face. So you want to sanitize your hands. So I'm taking a squirt of the sanitizer and I am rubbing it on my hands. Make sure you get your thumbs, your little fingers. You want to get your palms, the back of your hands, between your fingers, your fingertips, and then you just keep rubbing it until all of the liquid is gone and your hands feel dry again. And that should take at least 20 seconds, but you can count up to 20 slowly, or you can sing happy birthday slowly, and it will be just about that amount of time. So once you feel like your hands are dry, then you can actually consider them disinfected. And I'm going to show you first, before I put on the mask, how to store it. You can store your cloth mask or any mask in a paper bag. I've labeled mine inside. That's the side that is near my face. And you can see I've got the little ear string or elastic sticking out there so I can easily get it out of the bag. And then I've labeled the other side, the outside. So I'm going to take my mask out of the bag and put it on using those labels. So my Wisconsin Badgers are the inside, my Green Bay Packers are the outside, and on it goes. Good. Now, if you're going to take the mask off, you're going to sanitize your hands again before you take it off, and you take it off the same way from the string. If it's disposable and you're done with it for the day, you can just drop it into the wastebasket. Make sure the wastebasket isn't overflowing, so it's actually getting in there. Or you can put it back inside your bag. And again, you want the inside at the inside. And then when you fold the bag up, try to keep that ear string showing so it's easy to take out again. Good. How do you launder a cloth mask? Well, you just launder it like any other laundry, except try to use the highest setting for the heat of the water. And also dry it thoroughly with some heat because heat kills the virus. You can wash it along with other clothing, but again, because you want to wash it at the highest temperature setting, you may not want to wash it with clothes that require cold water. What do you do if you have the mask on and sneeze? You do the same thing that you would do without the mask. You sneeze into the crook of your elbow. So what about your cell phone? Well, your cell phone is, you're touching your cell phone all the time. You're putting it down on surfaces. So you really should be disinfecting or wiping your cell phone down on a regular basis. And because of that, you don't want to be putting your cell phone up to your face because that will potentially expose you to the virus. So try to use your cell phone on a hands-free setting and be sure you disinfect your hands after touching your cell phone. Finally, why do you wear a mask to the doctor's office? You wear a mask there for the same reasons you wear it everywhere, is to prevent yourself from unknowingly spreading the virus to the other patients, to the nursing staff, to your doctor or the provider staff. So remember, wearing the mask does not take the place of other precautions to prevent yourself and others from getting COVID. So you still have to do social distancing, staying at least 6 feet apart from other people. Hand hygiene, as we went over today. Don't touch your face, eyes, nose, mouth with your hands because that can introduce the virus into your body. And wipe and disinfect your surfaces, including your cell phone. So I hope this information has been useful. Thank you for your time and your attention. Stay healthy and strong and support others in staying healthy. That way we'll all get through this together. Thank you.